Today I'm going to give a sub-Q injection with an insulin syringe. So first, with the sub-Q, you can use a 1 milliliter syringe, and the gauges of this is 23, 25, or 26, and the lengths are 3/8, 5/8, and 1/2. And so for insulin, you can use a 100 units or cc syringe, but today I'm going to use a 50 units or 50 cc syringe. And so I'm going to check my doctor's orders, and it says 5 units, so that's how much I will be getting of the cloudy MPH and the clear regular. So after that, I will identify the 6 patients' rights. So right dosage, right documentation, right drug, right patient, right route, and right time. And so after I do that, I'm going to check any allergies of the patient to make sure and bring an antidote glucagon if they need, if their blood sugar is really low. So I'm going to go ahead and wash my hands and then begin getting the stuff. So I'm going to get an alcohol prep pad to clean my vials. So rub that. Okay, and let that dry. So we're gonna, since our order was for 5 units, we're gonna draw 5 units of air. And then we're gonna go cloudy, clear, clear, cloudy. So we're gonna go into the cloudy MPH first and inject 2 units of air. Okay, then we're gonna go into the clear and then inject 3 units of air. And then we're gonna turn this upside down, and then we're going to draw back 3 units of the clear, and then we're going to check with the verified nurse that that's 3 units, the clear. Then we're going to go into the cloudy and draw the remaining 2 units of the cloudy, and then we're going to check again with the verified nurse that we have the right amount. So we're going to recap this, and I'm just going to double check the drug's expiration date and that I have the right medicine, doctor's orders. And so after that, I'm going to go into the patient's room. I'm going to introduce myself, ask 2 patient identifiers, any allergies, make sure I have any food, and check their glucose levels, if I can give this insulin or not. And so then I'll wash my hands and then put on my gloves. So we're going to be giving this sub-Q insulin injection in the umbilicus, but the other places are the back of the arm, umbilicus, outer thigh, love handles, and the back. So then we got our gloves on after we wash our hands, so we're going to get an alcohol prep pad, clean the site. Okay, we're going to dry that off, and for this purpose I'm going to inject this back into the cloudy. Okay, and in that case, if my needle did bend, then I would go get a new one and do this all over again. So then with this, I'm going to pinch up the skin and then inject at a 45 or 90, but we're going to do it at 45. So we're going to go in and then inject and then wipe off any blood. After giving this insulin subcutaneous injection, I would then let the patient know, according to the doctor's orders, how many times a day for how long they're going to be getting this insulin injection. Then after that, I will dispose of the sharps correctly, and then before returning the medicine back, I will check the date of the expiration and check the medicine. And then after that, I will document everything that I did on all the appropriate documentation forms.